This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about are IME doctors biased? So IME stands for Independent Medical Evaluation. A lot of people don't know what this is, but if you're watching this video, sounds like you've been scheduled to go to one or you just did one or something like that. Basically what it is it's a visit. It's not a medical visit. It's more of a legal interaction where a doctor will see you. They'll review your records, see you, and then write their opinion and give it to whoever paid for that exam. So if it's a defense attorney, it goes to the defense. If it's a plaintiff's attorney, it goes to the plaintiffs. The document generated isn't even a medical document, it's a legal document. And the doctor actually has no patient relation with you. So they have no care is established. It's just basically to write a report. So a lot of people have very frustrating experiences with these, and it's understandable. They have an accident that's bad and they're hurting, and they go to see an IME doctor and they just say they're not having any pain or there's no reason why they're hurting. So the answer to the question in this video, are IME doctors biased? A lot of them are. If they're working for the defense, they're more likely to say things that support the defense. If they're working for the plaintiff, they're more likely to say things for the plaintiff. This can kind of get to the extreme where you have a doctor who will only ever deny injuries, or a doctor that will always ever support the injuries. So what ends up happening is both sides will get their own IME and then they'll fight over it. So there definitely is a lot of bias. I do them myself. I mean, I've met docs who really try not to be biased and some docs who are really horribly biased. The way I like to do it is I just tell the truth, and if they don't like it, then they won't use me again, and I don't care. And it will funnel me towards doing exams and telling the truth and finding lawyers or other entities that also want the truth to be told. So the IME doctor, if you're going into a biased doc, it's tough. Really, there's not a whole lot you can do. I would just cooperate. Don't lie. If you lie, it makes stories inconsistent and it blows everything apart. So the best thing you can do is just be as truthful as possible. If a certain area doesn't hurt, don't say it hurts. Don't exaggerate symptoms. As a doc, it's pretty easy to tell when the symptoms are out of proportion. And look, people can be in tons of pain. I'm not saying that. You can have high level of pain in any sort of area, but sometimes things don't sort of add up, and as a doc, after examining enough people, you can tell when it doesn't quite fit the mold of the way a certain pain normally presents. So honesty is really your best policy here. Some people will not show up for the IMEs. That usually does not work in your favor. They'll end up scheduling it again. It'll end up costing you and your lawyer's team more money for paying for all these IMEs. But yeah, from a patient standpoint, it can be extremely frustrating when the doc is very biased. But on the same token, your lawyers can also get their own IME. So that's kind of how the legal process works. Is it perfect? No. Is it frustrating? Yes. Is it expensive? It certainly can be. Usually you're not the one that has to pay for it. It's usually the legal teams, even though that may come out of a settlement. So to answer the question, are IME docs biased? Yes, a lot of them are, some less than others. Everybody has their own biases. Does that mean you should blow off the IME? No, don't do that. Don't make things up. It'll only turn out worse for you. So I hope I was able to answer your questions about this topic. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice about your condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.